Hi, my name is Rebecca and I'm a third-year student midwife. In this video, I'll be discussing prenatal genetic screening for women of advanced maternal age. In pregnancy, advanced maternal age is defined as anyone who will be 35 years or older when their baby is born. You may be wondering, what does my age have to do with genetic screening? And what exactly is prenatal genetic screening? First off, genetic screening is a blood test available to all pregnant women in British Columbia. This screening tells you the chance of your baby having trisomy 21, trisomy 18, or an open neural tube defect. A trisomy happens when a baby has an extra copy of a chromosome or extra genetic material. Down syndrome happens when a baby has an extra copy of chromosome 21. This can lead to physical and intellectual delays. However, those with Down syndrome can live into their 50s and have a good quality of life. Trisomy 18 also happens when a baby has an extra chromosome. Many pregnancies with trisomy 18 will miscarry. If the baby is born, he or she rarely lives past the first few days or weeks of their life. An open neural tube defect is when there is an incomplete closure of the spinal cord, such as spina bifida. As women age, there is an increased chance of having a baby with a trisomy. For instance, the chance of having a baby with Down syndrome increases from 1 in 840 when you're 30 years old to 1 in 356 at 35 years of age and 1 in 94 at 40 years of age. The chance of having a baby with an open neural tube defect does not increase with age and is 1 in 1,000 for everyone. There is currently no recommendation as to whether one should elect to do prenatal genetic screening. Rather, this is a choice every individual should make based on their own personal values and preferences. If you do like to screen, there are a few different options and they vary depending on what age group you belong to and if there's a family history or previous pregnancy with a trisomy. First, I'll describe a few different methods of screening. So the first is the Serum Integrated Prenatal, or SIPS test. This consists of 2 blood draws. The first is done between 9 and 13 weeks of pregnancy. The second is done between 14 and the end of the 20th week. The results of this screen are available within 10 days after the second blood test. Keep in mind with these, there's a high chance for false positives and there's a small chance for false negatives. If 5,000 women screen, 275 would screen positive. Of these 275 screened positives, only 13 would actually have a trisomy. On the other hand, of the 4,725 that was screened negative, 2 of these would in fact have trisomies, and this would be a false negative. Secondly, we have the IPS test. The IPS is Integrated Prenatal Screening. This is the same as the SIPS, the 2 blood draws. However, there is also an extra ultrasound. So this ultrasounds look at the fold of the back of the neck of the fetus, as this can be associated with Down syndrome. This test is offered to women aged 35 years or older at the time of delivery. The benefit of this method is that the first blood test with the ultrasound can lead to an early positive screen, and therefore results can be obtained earlier in the first trimester, rather than waiting until the second trimester. And also, the translucency ultrasound adds to the accuracy of the screen. If you are over 40, you also qualify for the IPS test. However, you can also go straight to an amniocentesis. An amniocentesis is a diagnostic test, meaning that it is 100% accurate. A small sample of liquid around the fetus is taken using a needle inserted through the mother's abdomen guided by ultrasound. The benefit of this is that it will tell you with 100% accuracy whether your baby will have a trisomy. However, this comes with some risks. The procedure is associated with a risk of 1 in 200 chance of losing the pregnancy and is also invasive and can be quite uncomfortable. There are also 2 private pay options available in BC. This is a NIPT, or non-invasive prenatal test, which is a single blood test taken anytime after 10 weeks. The result is available in 10 days and is highly accurate for trisomy 21 and trisomy 18. However, this is not covered by MSP. Women who choose NIPT will have to cover the cost, which can be $500 to $650. This is also just a screen, not a diagnostic test. However, it is much more accurate than the SIPS and is about 99% accurate. There's also first trimester screening. This option consists of 1 blood test and a special ultrasound, both taken around 11 weeks. The results are available the same day or within a few days. This test could cost about $500. The benefit of this test is getting the results early in the first trimester. If you screen positive to the SIPS or the IPS test, then you may do a NIPT or an amniocentesis. So the NIPT, again, blood test, and the amniocentesis is a diagnostic test. You may also decline further testing. So now that I've explained the differences between the tests, I will briefly outline some reasons one may or may not screen. There are several reasons why one may decide to screen or not to screen. Those are because you would want to terminate a pregnancy with a trisomy or neural tube defect, or you would want to arrange for adoption of that pregnancy, maybe because you feel you do not have the resources to raise a child with special needs. You may want to prepare emotionally and have all of the information ahead of time, or you would like the reassurance of having a negative screen. Otherwise, you may not want to screen at all because it would not change the management of your pregnancy and it would just instead lead to increased anxiety. So making a decision on whether prenatal genetic screening is right for you You have to ask yourself, do I want to know if my baby has Down syndrome, trisomy 18, or an open neural tube defect? What would I do with my diagnostic test results if the baby had one of these conditions? And how will this information affect my feelings throughout the pregnancy? Would having a screen positive result cause me too much anxiety? In summary, genetic screening is offered to all pregnant women in BC. Women of advanced maternal age may want to screen as they have a higher likelihood of having a baby with a trisomy, and there are several publicly funded and self-pay options available. However, not screening is also a reasonable option and must be decided based on your own values and preferences. And there's a handout to refer to with some figures. Thank you.